Thank you for introduction. Thank you so much for the opportunity for the presentation, and I appreciate it. I am working at GC Genome and researching in the field of microbiome. Microbiome research is mostly focused on the gut microbiome, and you may be unfamiliar with the urinary microbiome. Today, I'm going to tell you about the urinary microbiome. First, what is the urinary microbiome? Microbiome exists every body site in contact with outside environment. Human Microbiome Project conducted research from 2007 to 2017 and characterized the microbial communities across 5 different sites on the human body, but bladder was not included in the project. Healthy urine specimens were usually considered to be sterile because they didn't yield any bacteria on the standard culture method. But recently, as NGS become more popular, culture-independent molecular methods such as 16S ribosomal DNA sequencing have provided robust evidence for the existence of commensal urinary microbiome. The bacteria identified in the urine of asymptomatic patients are fastidious and slow-growing microbes like these, and they cannot routinely be detectable by urine culture or usually be considered as a contamination. Female bladder microbiome is highly similar to vagina microbiome, and on average, lactobacillus contribute to the composition of healthy female urine with more than 50%. Also, human urine samples generally have a low microbial burden in the absence of a UTI, hovering anywhere from 3 Winge of 10 to 5 Winge of 10 colony-forming unit per 1 milliliter of urine. And compared to gut microbiome, this is at least 6 Winge of 10 times smaller. So analysis of urinary microbiome is more technically difficult than gut microbiome. Next, I will represent the association between urinary microbiome and urologic disease. Among urologic disease, most obvious clinical significance of urinary microbiome can be found in urinary tract infections. Traditionally, urine culture was centered to culturing intestinal bacteria such as E. coli or Klebsiella pneumoniae, and it was difficult to grow anaerobic and fastidious bacteria. So many urine samples suspected of UTI did not any pathogens on traditional culture often. But in urinary microbiome analysis, that is culture-independent molecular method, bacterial DNA are extracted from the urine sample directly and further analyzed, so it can detect whole composition of bacteria whether or not grown in the culture. Analyzed results are reported like this as a proportion of composition of bacteria. So urinary microbiome analysis here is more sensitive than standard urine culture in UTI, but also in terms of treatment efficacy. In this randomized control study, standard urine culture and urinary microbiome analysis were simultaneously accomplished in patients with symptoms of acute cystitis. As a result, urine microbiome analysis showed higher sensitivity in bacterial detection as well as polymicrobial detection. But also, treatment efficacy and symptom score reduction were statistically high in patient groups whose treatment were carried out based on the microbiome result versus cultural result. Urinary microbiome analysis also very useful in recurrent UTI especially. Recurrent UTI can occur due to the periodical reactivation of pathogenic biofilm attached to bladder epithelial cells, and these pathogenic biofilms were periodically infected but did not eliminated completely and so formed. Standard culture assesses only planktonic bacteria in a minute amount of urine, typically 1 microliter, but urine microbiome analysis use these sediments, which are collected by centrifugation of 25 milliliter of urine and include detached blood epithelial cells as well as concentrated planktonic bacteria. So urine microbiome analysis can more sensitively detect the causative pathogenic bacteria in recurrent UTI. This more superior sensitivity of microbiome analysis, especially in recurrent UTI, was confirmed in data analyzed in our laboratory also. Interestingly, in 2017, Gilbert and colleagues identified that bladder exposure to Gardnerella vaginalis, which is associated with bacterial vaginosis, result in reactivation of latent E. coli, causing recurrent cystitis in mouse model. This result explains that women with bacterial vaginosis are more suffer from UTI than healthy female. So, if Gardnerella vaginalis is detected in the urine of individuals with cystitis symptoms, it should be considered. However, Gardnerella vaginalis is a fastidious bacteria and difficult to grow in the culture, but urine microbiome analysis can detect it well. To sum up, NGS test has several positive attributes to the diagnosis of UTI and is currently considered to be the forefront of the diagnostics of UTI. GC Genome launched a urine microbiome test in March last year. In the last 3 months, we analyzed 582 requests, most were female. About 20% of requests were reported as no bacteria present, and it may be due to the unlimited sensitivity of our microbiome test, especially in the samples with low microbial burden. And in female urine samples having dominant bacteria with more than 50%, lactobacillus accounted for the largest proportion, followed by Enterobacteriaceae, such as E. coli and Klebsiella pneumoniae and Gardnerella. But many bacteria never have seen in the culture are found frequently in urine microbiome analysis, and precise nature and role of the relevant microbes associated with UTI need to be further investigated. So MicroGene-Dx, NGS Diagnostic Laboratory, already actively conducting urine microbiome tests, and Queen's University Research Chair in Urologic Pain and Inflammation are working together to establish a baseline for what microbes are present in normal urine. Urine microbiome studies are also being conducted in urologic malignancies, including bladder cancer and prostate cancer. Carcinogenesis mechanisms by bacteria are increased inflammation mediated by microorganisms associated molecular patterns, MEMS, bacterial genotoxins, and bacterial metabolites resulting in the activation of genotoxins. Chronic cystosoma hematobium bladder infection is a long-recognized association with the subsequent development of bladder squamous cell carcinoma. However, not everyone afflicted with schistosomiasis develop bladder cancer. Recently, it has been shown that the presence of bacteria, such as these microbes in the urine, may contribute to schistosomiasis-induced bladder cancer through the formation of carcinogenic and nitrososamis. Also, bladder microbiome have been investigated for a role in the responsiveness of immunotherapy, especially in intravesical BCG therapy. University of Chicago group has recently reported data from a study in which they characterized the role of urine microbiome in 31 patients with high-risk NMIBC undergoing BCG treatment, and the enterobacteria were significantly more abundant in patients with recurrence, while lactobacillus were more abundant in patients without recurrence. BCG is thought to work by stimulating the local immune response through the attachment of fibronectin, and the urinary microbiome may play a role in modulating the response to BCG treatment by competitively binding cellular components such as fibronectin or regulating local inflammatory response. Chronic inflammation of prostate might contribute to prostate carcinogenesis via the formation of inflammation-induced fusion gene. And infections by pathogenic or opportunistic pathogenic bacteria are a hypothesized source of this chronic inflammation. In this study, urine was collected from men prior to biopsy for prostate cancer, and urinary microbiome of men with biopsy-proven prostate cancer may be enriched for pro-inflammatory bacteria that are associated with prostatitis, UTIs, or bacterial vaginosis. In conclusion, urinary microbiome is associated with various urologic diseases that are ranged from urinary tract infection to chronic inflammatory disease related in urologic malignancies. However, it has not been known since urinary microbiome analysis began, and research about the correlation between urinary microbiome pattern and host phenotype is still underway. So, precise nature and role of the relevant microbes in various urologic diseases needs to be further investigated to have clinical impact. Thank you for attention.